So our day in the life of our VIM clinic tour continues, and I have the pleasure of being with Dr. Mitchell Mutter. He is our medical director and our volunteer lead extraordinaire. Dr. Mutter, will you share from your heart as far as one, what drew you to volunteer here before even being our medical director, and two, the importance of why our patients need to, if they need the care and they're uninsured, they need to come see us.
Well, really, it's been a lifetime journey. As a child, one of 7 children, parents were deaf mutes. We were very poor, and we really had no health care. Our health care was emergency care from the time we went to dentist or any other medical issue. It was always an emergency. And so my frustration here is everyone needs to come here as their medical home and not as an emergency. Although we're available if you're a member of our medical home, the Volunteers in Medicine, we do want to see you. However, you need to come here to register as a patient. You qualify, it keeps you out of the emergency room. The emergency room is where, although they do a great job of taking care of emergencies, it's where you as a patient for routine medical care would get very poor care. They're not focused on patients like you. And they do a great job with emergencies again, but for hypertension, diabetes, other types of infections or other kinds of medical problems, you need to be at your medical home, Volunteers in Medicine. And this is for folks who are twice below the poverty level. So my expression about communication is talking when you don't need to talk. So when you do need to talk, you've got an avenue to speak. And so we are your communicators and your medical home, and we need to know more about you. So when it comes time that you have an urgency or an emergency, we can care for you. It's just as simple as that. And to end up in an emergency room around COVID-19 patients, trauma patients, horrible injuries, acute heart attacks, heart failure and respiratory lung failures, that's not where you need to be for routine medical care, although it seems to be the situation. The other part of the thing, in the big picture of things, it clogs up our emergency rooms and does not allow them to appropriately even take care of the sick patients. So my passion has been to try to get people where they belong and provide excellent health care for everyone. The critically ill in the true emergency rooms and the routine maintenance of health care at Volunteers in Medicine or other clinics and throughout the area. That's as simple as that.
Well, thank you so much, Dr. Mutter. And once again, continue to stay tuned here on Facebook and other social medias. We post our journey behind the scenes of our clinic today.